All right.
But this is how we do it, and then you're not talking. You're not even
Okay,
thinking.
and this is Dr. Flecky brought up the behavioral part of this. This is where I will tell you what we're going to do. We're going to clean and sterilize the area, and then we're going to numb it up with lidocaine. We will wait about 10 minutes so it takes full effect and spreads out. We'll check and make sure it's nice and numb, and then we'll do the biopsy, which will just take a second. We'll hold pressure on it for 5 minutes, and then we'll bandage it up and you'll be done.
Okay.
What were you doing?
I wanted to borrow Cheryl.
Oh, okay.
You want to stand right here for me? No, don't do that. Just bring your hip over here to the side and just use your hip.
So the alcohol.
Oh my God.
I was like, what headphones play up there?
Are you embarrassed?
No.
I don't think that's
She's
possible.
videotaping herself right now. She thinks she's doing a biopsy.
Okay.
Yeah.
So what I've done here is, on occasion, people's feet will fall to the side, and what that does is it hides your quad. Your vastus lateralis kind of disappears on you. And then the last thing I want to have happen is for you to have your foot in this position, and then we could do the injection, and then you let your quad slide over. Or vice versa, because everything, as Dr. Riekman's going to do, is aligned. We align everything.
Right.
So if you'll stand there for the rest of the procedure, that'd be great. But if for some reason you feel faint, let somebody know.
I won't.
Yeah, I've heard those stories before. Okay. We've had more people pass out standing here than we have there. Okay.
Don't mess this up, Cheryl.
We have multiple ways to hold the foot in place. You can just push this back, and there's a little bucket in here, and you can drop their foot in there. That will hold it up. Underneath here, there are stirrups that you can slide out. They'll sit right there. They can drop their foot in.
But heaven forbid we try that on a woman.
Yeah.
Funny story about that is a couple of guys were hauling these in here, and the stirrups kind of fell out, and they're like, "What are those for?" And I was like, "Well, we deliver babies in here." And you believe me?
Yeah.
What?
Are you ready for me?
Yeah.
Okay. So, what I joke around about all the time, you've just gotten a trailer version, okay, of what's going to happen, just like before a movie, right? The thing I joke around about all the time is that I have one and only one job, and that's to put a dot on your leg, which may or may not be used, depending on Dr. Riekman. So what I'm going to ask you to do is make a muscle on your quad. Yep, just like that.
Show them the vastus.
All right, so
they have a visual
yeah,
of
we
what
even
you're
have quad muscles.
So
Everybody
you're
get a look
using-
at this.
You're using black Sharpie? Materials. Kidding. Just go.
doing. Black Sharpie is important.
Not.
You think that's funny, but that
You know what?
He
He
would
is funny, actually.
he'd probably
All right.
faint if he didn't have a
Don't
black
pass that.
Sharpie.
All right, so he's holding it. Okay, see this crest right along here? Okay, that'll pop up when he makes his muscles. So what I'm going to do is go about midway between here and here, okay? And I'm going to draw a little dot. And then I'm going to ask you to relax.
Okay, no,
and you
actually,
just stay relaxed.
yeah, that's the normal, but just for purposes, let his foot drop, flex it again.
See that?
So if we're coming over top to get the biopsy, let it roll
Go ahead,
out
let it
even
roll
more
out.
exaggerated. See how it changes the angle? All of a sudden we're not
in the muscle.
going directly into the thick part of the belly of the vastus.
Okay, but we don't want you to hold your leg up. And in fact, we won't say a word to a subject. We'll just have somebody come over very quietly, stand there, and then just put the leg up or the foot up against, and then you forget about it. But then we don't want her to move for the rest of the time. So anyway, you saw where the crest was? That's basically where we're going to go. And then when the needle goes in, it's going to go in and kind of lateral. So we always pushing toward the skin, even though we'll be in the muscle.
Okay, next step, we use the iodine solution. We use these pre-packs of 3. You can also use just regular iodine and some gauze pads. These are convenient. So these have, you can see they have the swab here. And so what I'll do, I'll start in the center, and I'm going to scrub the center, and then I'm work concentric circles outward. The idea is that if there's germs or anything in the center, I'm pushing everything outwards. And then same thing as far as nooks and crevices in the skin. I did clockwise that time. This time I'm going to go counterclockwise. And again, work my way out. This is just one of those like way overkills,
With
but
a different iodine thing.
with a new
Okay, new one.
iodine.
We buy these in packs of 3 just for that reason. So we're never recontaminating things. When Alex pulls out the
So
gauze
now you go
pad,
clockwise.
he'll only touch one side of that gauze pad ever. The other side touches.
So
this
clockwise, counterclockwise, and clockwise.
But don't put anything on there.
Yeah.
Okay, so the other thing that Alex's job will be, as you can see, this is gonna start dripping.
So I can dip it.
So we catch once we're outside that circle, we'll catch that drip. And you might need more gauze pad.
Yeah, I'll need
You have
to-
little 2x2s?
They're here, I just didn't
Okay.
open
So-
them up, but
Why do we do that? There's no real reason to do that, other than the fact that we want to keep it, yeah, there is a reason. It doesn't matter if it escapes that area. It may stain its leg a little bit because it's it's got iodine in it. But what happens is that when Dr. Riekman anesthetizes this area, that circle area will become really numb. But anything falling outside of that circle will feel really wet, okay? And he'll be hypersensitive. So we start right now clearing that out, because if it happens during the procedure, you're going to think you're bleeding a lot. And so we just try to, and you may bleed a little bit, okay? But so we just keep that area pretty much out of the, you okay? We have a table right behind you. Feel free to sit down. It's all good. But it really, you'll be hypersensitive around there. You won't feel a thing inside that circle.
Are you messing with us? or-
No, I might do it too.
Please lay down then.
oh wow.
I'm not gonna think it, I'm not gonna watch that.
All right, so I flew in from Copenhagen, Denmark for a job interview at the med school in Arkansas. I've done hundreds of these things, right? And so they asked me to come hold pressure. Just got off the plane, went out, I needed to hold pressure. I am not kidding. I was holding pressure on this guy, and I just felt myself going to the point where the subject's laying there, and he goes, hey, and he slides over, and I laid down beside him.
Oh, I haven't heard this story before.
So it's nothing. It's not anything to worry about, okay? But
So you're only supposed to be touching one side of those gauze pads?
Right, so
Okay.
yeah,
so
well,
much,
They are sterile gauze.
they're sterile.
Anything going into this area needs
Okay.
to be sterile. So he's touching one side.
Yeah, and then the other side will touch him.
Okay.
And then anything that touches him, he won't touch, ever.
Okay.
Okay.
Okay, so the next step, you can see that I have two different size needles. One is 1 inch and one is 1.5 inches. The reason we do that is this is really for more obese, the longer needle. So this is going to go at the superficial level on the skin. This one goes deep, down to the muscle. Now, I don't need to use the longer one for a lean person, but it's just as standard, we just use it. So the first one,
This is the worst
This
part,
is the
I
1 inch? Okay.
that's fine.
It stings like a bee. Have you ever been to the dentist and got a lidocaine shot?
Yes.
Same thing. That initial little
So
pinch,
I'm trying to get
you'll feel it.
the
It's
tip
not
of the
bad.
needle right underneath the dot Dr. Flecky made.
Yeah.
It should make a nice little bubble like that.
And then it drains out?
You can.
Okay.
That
It'll-
one was-
it'll spread
was
out.
That one was the superficial?
Then this one, I'm going to go to the top of the bubble that I made, down to what I estimate is the top of the muscle, because going in the muscle is not going to help. Lidocaine is not going to numb muscle. You're just trying to numb the edge. So I inject a good amount down at the bottom, and then I'll do some as I pull out.
And then you can cover it.
yeah, I can cover it. Okay.
And just loose. So all we want to do now is keep the air off of it. Okay, so it doesn't have to be matted down. He throws a gauze pad on there, and it just keeps the air off of the top of the injection.
But again, anything coming in from the air, the iodine's going to wipe out. So it's just,
You want to start over the
Sorry,
timer,
do you
please?
do the small needle, are both of those iodine? Or the second?
That's
Lidocaine.
lidocaine.
They're both lidocaine.
Oh,
The iodine is
sorry,
the.
iodine is
the-
on top,
the
the
cup.
lidocaine
Yep.
is the needle.
Yep, they're both lidocaine.
They were both though, okay.
Yep. And as Dr. Riekman said, going into the muscle is irrelevant. There are no pain receptors in muscle. Okay. The only place you could ever feel pain is when we go through the skin, and that's what we're numbing. But we go all the way down to the muscle, and then come back out, making sure that we have dispersed it well.
So
Yeah.
that second needle, you go on top of the bubble.
Yeah, right at the top of the bubble,
okay.
and then all the way down to the muscle, and then I put a good amount there, and then I pull out slightly so that whole path, which is going to be the path of the biopsy, is numbed up.
How do you know when you're in the? You say
Straight
feel.
down.
Okay.
Yeah, I mean, as I was saying just last couple weeks, I told Dr. Flucky that I did an MRI in my brain of his leg, just a way of expressing of my sense of where the muscle is. Just something you learn.
Yeah, and that dot I drew, the reason I wasn't joking, he misses it half the time, but it's not because of me or him, it's because of you. Because that bubble may disperse kind of funny, and so he is shooting for the bubble. All I'm doing is giving him a proximity that we want to do. So you got the trailer version. This is where I step in and say, okay, now you get the director's cut. So I'm going to explain everything over again to the subject. And here's how I'll do it, and then you can, I tend to keep it pretty low-key, but so we're going to hang around for another 8.5 minutes.
So you let the lidocaine, you wait 10 minutes after? Okay,
Yes, I do.
okay.
Okay, so this is part of the trailer version, or the director's cut version.
Okay.
We had the timer going. I don't know if you caught.
Okay, so
Him
we started
asked
a
me.
timer. And I might make a joke, depending on who it is. Okay, like, well, we're going to go at 10 minutes, but if I get distracted, 11 minutes, you won't be numb anymore, but, no, it's like the dentist. It stays numb for a long time. All the 10 minutes is doing is buying us a margin for error. It lets that lidocaine disperse, which allows us to be a little, we don't have to be absolutely precise, okay, when we can find a good place to take a biopsy. So the first thing I'm going to do, and this is exactly how I tell the subject, okay? First thing I'm going to do is poke and prod around a little bit. It should feel something like that, okay? We can't numb pressure. Pressure is very deep. It's near the bone. So we can't numb that, but we can numb the pain, and it should feel like this. On occasion, people feel a momentary pinch. If that happens, let me know. If that momentary pinch is pinch, 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 let me know. You're not numb. We can fix that, okay? But generally, this is what you're going to feel. So here's what I've done. I started out telling him how it was going to feel. I warned him of a pinch, and then I reiterated to him that this is what he should feel, which puts the mindset back at ease, okay? The one thing you want to be is completely relaxed. And so sometimes I can raise your angst and make you relax, and sometimes I can just, it depends on who you are. Sometimes you can crack a joke and you just completely forget about what's going on, right? Other times you have to be a little more serious and a little more professional, and, and we just kind of feel that out. Okay, so after we've done our poking and prodding around a little bit, Dr. Riekman and I will load up a biopsy needle, and it's just that fast, okay? In and out, all done, but then you have to put up with this guy. This guy is going to hold pressure in the area. We actually biopsy a muscle that's not associated with much bleeding, but to minimize any risk of bleeding, he's going to hold pressure in the area for several minutes. After which, Dr. Riekman's going to come over and bandage you up in a special way to keep everything nice and tight and infection-free, okay? And then he's going to tell you how to take care of it for the next 3 days. Okay? All right. So that's all.
And then
we do.
I tell you, he's lying about this. It's all a lie.
You let her know. You let her know if that's what you feel or not.
I'll do that.
When I do this, it's usually harder than what you actually feel.
And if you were one of the students and what you just did, I would be taking you out in the hall and having a word. That
Oh, because I touched
don't-
his
you
leg?
don't
Touch.
go near that.
Oh.
That is like sacred area. Only he is allowed in
Don't
that area.
touch that leg.
There's been 2 times where I've done this, and somebody grabbed me and go,
Oh, they got mad.
"You are going to do the other leg, right?" Yes, I am.
So even Dr. Fleck stays away from there until we're doing the.
Yeah, I don't go anywhere near there.
Okay.
And then I don't typically put on a lab coat until about now, and I always talk down that I don't have any roll, And then I put this lab coat on, and I've usually joked around how I pass out a side of blood, and I'm just in here to draw a dot. And then I put this lab coat on, and they're going, whoa, what's he doing? Okay. There was a time, it was one of the greatest moments in our biopsy history, where a guy named Mark Perez, did you know Mark? He was an HLKN undergrad. He came over and helped us. And every day I'd come in and I'd draw the dot, and we'd have a brand new subject, who's never seen it before, never knows nothing about it. And I'd be standing at the end with Mark. Mark would be holding the foot, and I'd go, man, all these dots I've drawn, you think there'd be once that Dr. Reef would actually let me try biopsy. And Mark goes, just ask him. All right, I will. I'm going to ask. So Riekman's out of the room. He's getting something else going, and Riekman comes in, and I said, you think after all this time you might let me try this once. And Riekman he just kind of stood over, and he looked over. Whatever, go ahead. Subject's eyes, really big. And then looking at Riekman, looking at me, and expecting me to bow out gracefully, and I go. I scramble over to the cabinet to grab a biopsy needle, and the next thing you know, the subject's like, what's going on here? Okay, and then Mark basically had to settle him down. It's like, oh, no, we're just kidding with you. But sometimes that actually alleviates the stress. Other times it doesn't. You just have to kind of get a feel for that. The one thing that I'll say is typically when we do a biopsy, it's the pressure person's job or the subject, the coordinator's job to talk to the subject, okay? And you don't talk about anything other than, it's all trivial stuff, okay? The worst thing that happens is when the person standing there helping you is talking to the subject, and then as I'm doing something. Because now the subject's freaking out. Okay, what just happened here? That you had to stop all train of thought. So we actually do a lot of schooling to the people who help on pressure to make sure that they don't disengage with the subject at any time. They're just talking. Because if you haven't seen a biopsy, the needle part's the least worrisome. Okay, it's what I'm going to do next that freaks some people out. Okay, so I'm just saying. Wouldn't you agree?
Yeah.
It's one of those
First
things
time I
like,
saw it,
oh my gosh. And so the last thing we want is for you to be looking into somebody's eyes who's got that oh my God look on their face, right?
Now you're ready.
Well, I'm just telling you because it's not fair to him if I don't.
All right, there's another thing I want to point out. Alex is doing really well. He's sitting here with his hands like this, and I can just tell you that I have to frequently, when we have a student as a pressure holder, they're like reaching, their phone goes off, and they reach in their pocket with their gloves.
Or worse.
Yeah, they're adjusting the shoes, the bottom of their shoes. Okay, once the gloves, people think of the gloves as protecting themselves. They're still protected when they touch that. You're protecting everybody. The gloves go on, you don't touch anything. He's touching gauze pads in this area, otherwise here. No reaching in your pockets, no scratching your nose. And if you have to do something like that, it is fine. You just change your gloves out. It is very, very important. And I watch him like a hawk to make sure
Like this,
that
guys.
I can get your face. You gotta
he
bring it down.
knows. He knows.
Excellent, excellent. Oh. I need to know what you're doing over there.
Again, there's another standard procedure. We have soap over there. We scrub our hands when we come in, and then we frequently use the hand sanitizer. So we do double. Again, we do double on everything. Overkill, overkill.
I can't smell anything. I haven't smelled anything in weeks because of this sickness that I had, but I think I
I can
burned
smell
up
it.
the olfactory. Okay, that's purposeful because it smells very clean.
I
Right.
can't smell it.
So I go use it, air dry, right? And now, what our whole goal is, we're convinced we can do this extremely well, but to satisfy the subject, we need to make sure we reiterate those. They have the right smells. They see the white lab coats. Everything. Okay.
So you can touch all of that other stuff, like the stuff you just grabbed
This
over
this
here?
is an
Oh, what did you
area.
just grab?
Yeah, this is
Dr.
an area
Reed
that
touches nothing.
this area is a protected area as well.
What'd you just grab and move?
Dr. Reedman's interaction with the subject.
You'll see these in a minute.
Oh, okay.
You'll never touch the subject until it's time to bandage him.
Okay.
I went to Cece's Pizza once after the dentist, after getting lidocaine. Worst experience
I don't
of my
need
life.
it. Technically.
Oh, that's
Cece's Pizza.
You did. You
I went with my
stopped.
best friend, and I was like, yeah, sure, I just went to the dentist, but I'm sure it'll wear off soon. And I was like, like water's like dripping out of my mouth.
Put lab coat on.
That
Oh,
pleasure
Alright.
of eating.
Yeah.
You can't even taste
Stay away
anything.
from my name.
I didn't get it. Don't worry.
My lips felt like they were like 8 times the normal size.
You know, I feel on a regular basis.
Alright.
Feels good.
I got it. It's okay if some other folks didn't. I got you.
I know how you feel.
Well, I didn't say that. I said I know what you're talking about.
Oh crap! I didn't get your face. My
All right,
my
we ready?
camera
Sounds
Are
like
you
you got
ready?
my face.
Can we get started?
Yeah, go ahead.
I'm just saying.
Yeah, sure.
All right, so the only thing I don't have that I'm going to need is some forceps.
No, we're.
Just in case we lose the needle inside his leg, I can fish it out.
So we set up after the procedure. We set up an area to collect the sample out of the needle. He's gonna put the forceps there.
If I can find them.
I have some scissors.
Oh,
You
get
can
those
just-
ones off the floor, yeah.
I don't know where the forceps are. There's only the big bumpers here.
Don't get my crotch.
Oh, I've gotten everybody's crotch in this. I don't know where else. I guess I could do chest down.
I got-
Getting my face.
they
No,
won't
I
go
don't have
in.
your face. You don't want me to get your face. I can't.
All right, so the forceps will be over here where we take the muscle. So after we take the biopsy, you're welcome to come over here and see.
You had to put new ones on.
Well, I was gonna go in the other room and
Grab
the
some
autoclave to sterilize the needles is in the other room. So I was gonna run over there.
Single use only. These are sterile. These are not sterile. They're clean, but they're not sterile. But he won't ever touch the subject using those. But these are sterile, and they're actually sized. It's not a small, extra large, large type deal. These are 8.5s. They fit both of our hands pretty well. And then when you put a surgical glove on, you never touch the outside of the glove. So they lay open. Okay, the way they design this is they're cuffed, and basically, you see the cuff there? All right, so put on a, I'm actually doing this completely, but, no, that's not true. You stay away from
The outside.
the outside, okay? Then you come over here, these are sterile, so I can slide underneath the cuff here.
Ah. Camera.
Voila. Okay.
I got 20% battery, so.
Yeah, this goes the same thing with the needle. When I was loading the needle, I'm exposing the scalpel without
Never touch it.
never touching it.
Okay. And this is a scalpel. You wouldn't know this normally. As you can see, I've always got my body between him and the action. And that's purposeful. So now I just come in, I take this.
It had a cap on it.
There's
It's
a
right
cap.
there.
There's a cap inside.
I held it while he was pulling it out.
I check for the fineness of the point, and this is what I just prefer, this particular type. And then I come over here, and again I keep everything kind of off to the side. All right, so now okay, so you can see where he went and made the bubble. That's the upper one. The other area is down a little bit, and I'm basically going to do the poke and prod now, and I would just be telling you that you just need to tell me what you're feeling.
Keep pushing on it.
Yeah, just a little light pressure, no pinches.
No, come
Don't,
on.
don't think. Come on.
Yeah, so that's the time to say it.
Yep.
Because he's laying on the table under the knife, hearing you say, "Oh, that is really disgusting."
Thanks, Emily.
You are
Yeah.
welcome.
Yes,
Yeah.
that is.
Hold on.
Yeah, that's one of those that'll get you ushered out of the room if you're helping us, because it's just something that the subject never wants to hear.
Again, same technique here. I'm exposing the needle without touching it. So I'm gonna hold it, open it, peel it.
All right, this piece never touches the subject, and I just drop that into my pocket, and it's the only reason I wear a lab coat, really. I don't like lab coats, but I need a pocket. The next thing I'll touch is the trocar part, and then the barrel, and what you'll see is that I'm not going anywhere down where this will touch the subject. It's a rubber gasket that sits on top. It allows Dr. Riekman to pull some suction.
All right. So for the suction, this is a regular standard laboratory pipette, but we've cut off the tip to open up more vacuum space. This is standard IV line that we've cut the tip off, and I just put that in there. This is a 140 cc syringe. Go in the top. Make sure
Again,
it's tight.
Dr. Riekman never touches the needle, okay? And then I just come over here, and I just very easily lay this right into the, and I can feel right where I've cut the fascia, because the needle just dropped into the muscle. Done.
Yummy.
That was what?
The good thing is there's nothing to hear.
So what'd you do with the section? What were you doing while he did that?
As soon as it went into the belly of the muscle, I pulled suction. He opened it, the muscle fell in, he snipped it, pulled the whole thing out.
The reason I'm not looking is because I'm like, well, might as well not psych myself out now, and I'll just see if Ben does it.
I was about to say, it's a good thing.
As long as Ben still wants it.
Yeah. Well, it's wild because then he really does take a scalpel and just put it into your leg.
Well, sit down.
You're welcome.
And you're putting pressure on for how many minutes?
Typically till there's no more bleeding. So I'll check it after about 3 minutes or so. Call Dr. Riekman over. He'll give it a check.
We have them right.
Yeah, it just feels like
So you must encourage them not to.
that just felt like.
So
Well, I don't even like people helping with pressure to have one before they.
Labeling. I'm going to label
I felt
6,
like afterwards when you were
47,
I wasn't sure if like what I was feeling
2013,
touching me
number
somewhat
1.
with the gauze pad, or if I was just like bleeding out.
And you're just gonna put the snip in there. Okay.
This is a so-so muscle. I've done much better.
It just felt like.
He was so much deeper than I thought he did with that needle. Stop it, Dennis. You watched it. I did. He goes.
It's not bad at all.
So what was Riekman? He was just sucking pressure.
Yeah, basically. Okay, I'll explain
Yeah.
it.
It's so small.
Yeah,
It's probably
we've done better.
discomforting- Or discomforting seeing it, but you really feel that.
Oh, so you even think it's small.
Yeah,
It's
this
not
is a small.
normal.
No, this is a little bit on the light side, but as you can see, every time I pull something out, I pull new sheets out,
Yeah,
and those sheets are telling me that he's pretty well trained.
I'll be okay. I just want out of here.
Please.
Oh.
Well trained.
Pretty well trained.
Yeah.
Because you don't get the sheeting without some training. And then we look for every little bit. Okay? Once that happens,
Put it in the dress.
temperature, liquid nitrogen.
Describe the suction
Liquid
for you.
nitrogen.
You can see what's happening. I'm going to open up one that we're not going to use. So you saw it over there when he was getting the sample out. But right there, it's closed. You can see that it's closed. So
What are those parts called?
trocar and yeah. So the suction, I'm just describing the suction here. So I'm drawing suction through here. You can see that there's a It goes through. So right now, it's in the muscle, it's closed. I draw suction, and then he opens it, and that suction all of a sudden is released, pulls the muscle into the hole, and he snips it off. This is razor sharp.
Oh.
So the suction just gets maximal amount of muscle in the hole there.
Okay.
That's like the biopsy. That's the cutting.
Do I need all this cleaning over here? Please?
We'll get it the next time.
Okay.
I thought it was just gonna go